So we're starting with one of today's big news stories, actually. It's been revealed that women's healthcare in the UK is one of the worst in the Western world. Now, the UK scored just 60 out of 100, putting us on par with countries like Kazakhstan, Slovenia, Kosovo and Poland, and way below Australia and the United States. So you'd think we'd be up there, Janet, with Australia and the United States. I mean, no disrespect to those other countries, but we are a relatively rich country, and you'd thought that healthcare for women would be up there like America and Australia. Why isn't it, don't you think?
Well, yes, and all the countries involved in this poll also suffered. They've been through COVID and the lockdowns that we have too. But I think the main thing that happened was, first of all, lockdown, where we all stayed at home. Then fear of going out, fear of mingling with people, that confidence returning as we got our jabs. But then the backlog of appointments, how hard it was to get an appointment.
Doctor surgeries were closed for ages.
Doctor surgeries was closed forever, and then you had to do all the talking on the telephone. And, well, we know how to still do for a lot of people. I think 40% of appointments are still on the phone. And I suppose what's happened as well is that as we return to normality, women put other people first, put their partners and their children first. And now we've come to this shocking situation where they're saying that millions of undiagnosed cancer cases are going to be the long-term result. And there's figures out today showing that I think a third of older women who are eligible for cervical cancer smears just haven't had them. Now, I want to beg every woman watching who's eligible for any kind of smear or test like that to please take it up, no matter how irritating and bureaucratic it is dealing with the doctor's surgery and the NHS. But there is another side to this. Don't you think it's time that the NHS came to us instead of us grovelling and inching towards them? I want to see...
In what way? What do you mean?
Well, like during COVID, we were really good at rolling out the vaccine, really good at testing people and really good at building those big Nightingale hospitals. All right, they didn't get used that much, but it proved we had a can-do attitude and, in my opinion, we did a pretty good job. So why can't can't we roll out cancer, taking on cancer like that? In every way, bringing testing stations to supermarket car parks, allowing us to have our blood tests in the chemist instead of having to go through this charade.
When it suits.
Yeah, when it suits us, as opposed to when the GP's available.
That is difficult, Katie. Yeah. Because I think Janet's right that women do tend to prioritise everybody else. So we're our own worst enemies sometimes. Because we go, I haven't got time. You know, you've got time if it was your children, got time if it's parents, elderly parents that we're looking after. We make the time, but when it comes to our own health, we're always too busy. Or often too busy.
I think as a country, we're always about cure rather than prevention. Prevention sometimes feels like a luxury and, you know, not a necessity. We go when things are falling apart and we can no longer function. And I think you're right, naturally as women, whether we're mothers or not, we're often the nurturer, the caregiver, and we'll be running everyone else's medical diaries and appointments, and we'll often feel selfish to take a day off to go and get a blood test when they're only on Friday mornings at 11 p.m. We wouldn't dream of calling in, you know, sick at work if we weren't really sick to be able to go to that appointment.
So, you probably wouldn't call in sick, thank you, if it's like, you need a blood test if you're ill, you're ill. But if it was a blood test for you, you might go, oh, I can't that day, I'm working. But if it was your children, I bet you'd say, you'd cancel work.
You do it all the time. You know, I had an appointment for Parker last week and I made sure that that time in my diary was free and I made sure Parker got there whatever time they gave me, I made it work. Whereas I know full well if that appointment was for me, I'd have been like, oh, no, I've got to pick the kids up that day and then actually I've got work in the morning and I can't really make that work so I won't get back in time for dinner. And I think we do that a lot, but I also think they don't help in, like we were saying, you go to an appointment and then they say, OK, you need to have a blood test. Oh, but we only do blood tests on a Wednesday. And then you're like, OK, so I've already taken Monday morning off work to go for an appointment. I'm here now, and now I've got to talk to someone to try and get childcare or to get the day off work to go and get this done. And I know as well, people kind of hit brick walls. I've got quite a lot of friends that have suffered with endometriosis and things like that, and often they get to a certain point and the doctor kind of goes, well, I don't really know what else to do with you now. And as women, I think you just go, oh, OK, it's just another women's issue. No one knows what to do with it. I'm just going to get on with it.
We're often labelled women's issues.
Well, I mean, recently there was this huge campaign fronted by people like Davina McCall, a very good campaign to try and get employers and the government to realise that when women are going through the menopause, they deserve not only compassion, but, you know, leave from work, and that it should be categorised as a health condition that allows you to take sick pay and so on. And guess what? It's just had the knockback in Parliament because MPs say they can't put it through because it might discriminate against men.
Yeah, except, I know what you're saying and I agree, because when I first read that, I go, oh, but surely any long-term or any health condition that is so debilitating, whether you're a man or a woman, and it means you have to take time off work, should be treated in the same way. So I think what they're saying is if you said we are making the menopause a protected characteristic, therefore you can't lose your job because you've taken too much time off, there might be men with long-term health issues that aren't menopause, clearly, that say, well, that's not fair because then I'm not being protected.
Do you know what?
Then they don't get the menopause.
Well, this is what I would worry about, because whilst I'm supportive of it, and I absolutely think if you are going through something like that, it's debilitating, it's a medical condition, you should be allowed time off. If Parliament had brought it in, would you see more discrimination against women of a certain age in the workplace where they just wouldn't get employed, they wouldn't get promoted, they wouldn't be seen as capable, just like how younger women can suffer when their employers know they're about to start a family? Would we start discriminating against women because we know they'd have that leave?
But they also say that, the government says, the response to this, they said that if women who suffer substantial and long-term menopause effects, you should already be protected from workplace discrimination under the age, sex and discrimination laws. So that they're saying that there are already laws there, that if you feel that your employer has let you go because you were taking too much time off with your menopause symptoms, that you maybe do have some recourse to...
I do think there are a lot of people... I think it's education as well. Me and Katie were saying earlier, we knew nothing about the menopause until we came on this show. I just knew everything. I just thought you got a couple of hot flashes and then that was it. But I think now, if people really thought about it, and we've had people on the show where it's completely, like, debilitating.
Yeah, we asked you at home how many of you had maybe had to leave a job that you love often, and a fifth of viewers said that they've had to leave work.
That's really sad.
Well,
Isn't it sad?
The government's got to remember one thing. The next generation of babies and children in this country aren't going to come from outer space. They're actually going to come from women. So maybe they could prioritise our health.
And also, you know, we do have a depleted workforce. They're saying they're always trying to encourage people, particularly women, to stay at work and be at work. And yet
stop making it so hard.
Stop making it so difficult for them during menopause, because it happens to everybody. And some, as we said, so debilitating that they feel they have to leave often jobs that they absolutely love. And let us know. We love to hear from you. Let us know what you think about that. Is that you that we're talking about there?